Welcome, everyone, and thank you for taking the time out of your morning or afternoon to join us as we continue our presentation series on the heart of rural nursing in South Dakota. Today, the focus will be on social and community support. Um, Before we get started, just a few things to note. You are automatically muted when you join the call today. Should you have a question during the Q&A, which will happen sporadically throughout the presentations, you can just feel free to unmute your microphone and speak directly to the presenters. Alternatively, you can feel free to use the chat feature at any time and we can field your questions for you if you have something you would like to ask or contribute today. We want to ask that you keep your video on at all times. It just helps keep the conversation flowing and allows everybody to see who's talking and get to know you. Also, if you would please introduce yourself if you are speaking, especially because we have a few people sharing links. It just helps us know who you are so we can address your question properly. We do want to ask that we continue to maintain confidentiality at all times when we're sharing feedback, case studies, or anything of that nature. Please keep in mind that in order to support the growth of the ECHO movement, Project ECHO does collect participation data for each tele-ECHO program. And we just want you to enjoy the presentation, be active, be ready to and learn. Try to reduce your distractions. Again, keep your microphone muted so we don't have any feedback from other microphones since we do have a nice audience today. And just be excited for what we're about to hear. These are always incredibly insightful discussions. By way of introduction, if I haven't met you virtually through these series before, my name is Stacy Villano, and I represent the Global Rural Nursing Exchange Network, or GRNEN. It's our mission to support nurses, educators, and students, really anybody in the health role who share a passion for improving the health of rural communities and an appreciation for the role nurses play in serving these communities. We are an international organization, so we have a membership that is across the globe, and that's one of the most exciting things about the partnership here between GRNEN and the University of South Dakota. Through this relationship, we are really able to take the real life experiences that the nursing students are going through during this incredible HRSA opportunity and bring it to a global audience. We have a lot of shared experiences in underserved communities. Obviously, there are differences either geographically, culturally. So it's really interesting to shine a lens on this part of the world in order to help examine what's going on in the rural communities, to encourage students who are interested in pursuing rural as a focus point in their career, and to encourage educators to help bring these rural experiences to the classroom when they're teaching their nursing students. Our presenters today are Helene Heggie and Katie Franson. Helene has practiced nursing for over 35 years. She has practiced in many different clinical areas, including as the primary RN in rural health clinic for 10 years. While working in the rural health clinic, Helene obtained her master's of science in nursing education and has been an educator at the University of South Dakota for the past 10 years. Katie is an instructor at the University of South Dakota in Vermillion. She has been a nurse for 14 years and has worked in a rural health setting and contributes to work PRN in a critical access hospital. Katie is a coordinator of the USD Nursing Lab and Simulation Experiences and is also the co-lead for the USD HRSA experience. Now I'm going to go ahead and turn it over to Helene and Katie as they take you on this journey today.
Great, thank you, Stacy. So first, I'm just going to tell you about the HRSA grant that we received. So the HRSA grant was awarded to University of South Dakota in the fall of 2022. We were awarded $1 million for a 3-year experience. So there are two parts to this grant. One is the recruiting of nursing students to the nursing profession, especially looking at the Native American population. And then also the second part is getting more nurses into those rural areas. So with that recruiting side of it, our team has been visiting different schools and hospitals. They've been holding fairs and attending events. And every year the grant specifies that we visit the tribal nations 2 times. So there are 12 tribal nations in the state of South Dakota. To meet that objective of getting more nurses out to rural areas, we've been placing our students in rural hospitals for clinical experiences across the state. They complete 135 clinical hours and immerse themselves into that community. The students have all taken a survey before and after the experience, and to date, we've placed about 70 students in these rural experiences, and all of them have reported an increased knowledge and interest in rural health nursing.
Next, we're going to talk a little bit about what rural is here in South Dakota and where we are at. So just a reminder to everyone that this presentation is on a global rural nursing exchange network website and will be seen globally. And so when we're talking about our community, we really need to be very specific in talking about it because we are a very unique state and a unique community in South Dakota. And so, as you can see in this map, South Dakota is located in North America, and we're located kind of in the middle part of the United States. And on the next slide, you will see the picture of the United States and a little X's on the south side of South Dakota. And this shows where we are at in the United States. The region that we are in is called the Midwest. And we are located in the central area. The climate in the central area, we have all 4 seasons, and we are just now starting to kind of get into our winter weather. It's getting a little colder. We've had a little skip of snow, but we expect to have much more snow going forward during the winter. And then our next slide, we're going to look at the state of South Dakota. Now, all of the blue dots are where all of the rural access hospitals are in South Dakota. And the red X's show where we have placed students through the HRSA grant experience. And so you can see we've covered many of them, but we still have more to go. And by the end of this grant experience, we would just really like to have students into each and every one of these rural access hospitals, if at all possible. And so we're really working hard at getting students placed throughout the state of South Dakota. So a little bit about South Dakota, and I know many of you that are here live here and know it well, but just talking to those that are not from our area, on the western side of the state is where there's a mountainous range called the Black Hills. That is where Mount Rushmore is also located. It's a beautiful area now. During this time, they'll be starting to have skiing. They have ski resorts there. So there's tourists that come from all over to the Black Hills, to that area. Across the state of South Dakota from west to east, there is an interstate, which is a major 4-lane highway for that goes across the nation. And then also on the eastern side of the state, from north to south, there's also another interstate that goes from the south part of the United States all the way up to Canada. So there's a lot of traffic that goes through South Dakota, and granted, they will stop along the way and maybe are intentionally coming to South Dakota, but South Dakota gets a lot of traffic going through just because of those 2 major interstates. The eastern side of the state is more agriculture, and there's a lot of land, farmland, And in the central part of the state, there is more ranching and more, you'll see big ranches with cattle and horses, and it's a wide open range area in the center part of the state. The largest city is on the eastern side of the state, which is Sioux Falls, South Dakota, and on the western side of the state is Rapid City, the second biggest city. So those are the areas that have the major hospitals in the state. And so many times that's where patients have to be transferred to for care. And you can see just by looking at this, how far that would be to go there for acute specialized care. The distance across the state, if we went from the west side of the state to the east side of the state, it would take you about 7 to 8 hours to travel across the state of South Dakota. So that kind of gives you an idea about how big South Dakota is. Next slide, Stacy. And so we have been talking about our specialty. We're talking about social determinants of health. And I know everybody knows what social determinants of health are, but we're going to just go over it again. And social determinants of health are the non-medical factors that influence health outcomes. They just really encompass the condition in which people, where they're born, where they grow up, where they work, where they live, how they age, and as well as how it just shapes your daily life, depending upon what type of access you have to care. So as you can see, there are some key areas here with social determinants of health. In previous webinars that we've had this fall, we've talked about education access. We've talked about healthcare access. We've also talked about economic stability. And we've also talked about food insecurities. So, but today we are going to talk about social and community context. So social integration, community engagement, and support networks in the community can influence mental health and physical health. And so having those strong social connections can really provide emotional support and can reduce stress, and then can also improve health. So having access to quality community programs can really help to improve the health and is a way to access care. And we're going to be hearing more about that from our specialists later on in this presentation. And so on the next slide today, again, to remind everyone, this is an all teach, all learn echo session. So this isn't a presentation. This is more of a conversation that we are having. So we welcome input, questions from everybody here. And even if you've experienced something in the community you live in or the community you've worked in that you can relate to the topics we're talking about, we just really ask you to share, because it's good to hear what goes on in many different communities across South Dakota and even other communities across the United States as well. So today we're going to examine the various health challenges faced in rural communities of South Dakota, where they're going to identify and explain how social support systems such as family, community networks, social services affect patient health and recovery, and then particularly in the rural populations. And then we're going to explore ways to advocate for patients by addressing social and community-based needs through interventions, referrals, and collaboration with other professionals in the rural communities. And so now we're going to go on to our case studies, and I'm going to hand it back to Katie.
Great, thanks, Helene. So our first speaker today is Lizzie Kingenberg. Lizzie is from Parkston, South Dakota, and she will be working at Avera McKinnon Oncology after graduation.
Thanks, Katie. Like she said, my name is Lizzie. I'm a fourth semester USD nursing student, and I got the opportunity to do my HRSA grant in Avera St. Benedict in Parkston. Parkston is a small farming community located on the southeast side of South Dakota. It's about an hour and a half from Sioux Falls and 20 minutes south of Mitchell. The whole town itself has about 0.91 square mile radius, um, and the population is around 1,500. Mary St. Benedict was built in Parkston in 1934, and since then the location of the hospital has changed, and they added on a clinic, assisted living, and a nursing home. Hospital itself has 35 inpatient rooms, 3 labor and delivery rooms, 3 emergency rooms, and 1 operating room. Because Parks is a critical access hospital, their goal is to treat emergent patients to get them stabilized and send them to a higher level of care. Sometimes we transfer patients by ground on ambulance, or more critical patients are flown out to bigger hospitals. While I did my clinical experience at Avera St. Benedict, I took care of a variety of patients. I got to watch C-sections. We had multiple ER patients. Cared for a lot of patients with chronic diseases such as COPD, CHF, diabetes, and swing bed patients, which are usually patients that just needed a little bit of extra help before they could be sent home. We also did lots of procedures like colonoscopies, EGDs, endoscopies. A benefit that Parkson had in their hospitals, they have access to telehealth services. They have cameras in each of the emergency rooms that are connected to an EICU system that is available 24/7. So the doctors in Parkson can have another set of eyes and help when there's critical care situations. And talking about social community aspects, Parkson had a transportation system that they would use if like patients couldn't afford their own car or just weren't able to drive, and it was called Rocks. And they would send out a call and they would come pick them up for a low cost. They also had Meals on Wheels where the hospital made food and there would be volunteer drivers to deliver the meals to people that needed assistance.
Great. Thank you, Lizzie, for sharing. Now, is there a public health office in Parkston?
I don't believe so.
And maybe Paula can share a little bit more. I know we haven't introduced Paula yet, but is there a public health office affiliated with the hospital in Parkston, Paula?
Yes, so it's an unusual situation in that in the 70s, the Department of Health set up you know, community health nurses in each of the counties, and Hutchinson County had a nurse in Olivet, and probably, oh man, 15 or 20 years ago, the hospitals took over. So there is actually a community health nurse office in Parkston, and then there's also one in Freeman at the Freeman Hospital. And Becca Melhoff is the nurse there, and she provides services out of the office there. So, but to be honest with you, Lizzie, I'm not surprised you didn't know about her because she's kind of tucked back into a corner. And I've always said public health nurses are the best kept secret in the world. So don't feel bad about that at all.
Thank you, Paula, for sharing that. So yeah, and it's good to hear that there is a public health nurse there. But yeah, as you said, kind of back behind the hospital around the corner. So yeah, Lizzie, any thing else that you saw? Those were great resources that you shared that were in the community of Parkston. How about when the people left the hospital and they went home? Were you involved at all in their care planning for after they left the hospital?
Yeah, I had a couple patients that were sent home with home health where the nurses would go home or to their home and help them with cares so that they could continue to get better but be in their own home.
Great. Nice.
Okay, well, thank you, Lizzie. We will move on to our next presenter. So our next presenter is McKenna Ward. McKenna grew up on a ranch outside of Belle Fourche, South Dakota. Upon graduation, she plans on moving to North Carolina in hopes of finding a position on a cardiac unit.
Okay, thank you, Katie, for the introduction. Yes, my name is McKenna. I was able to grow up right outside of Spearfish, actually, on a ranch, so I'm very familiar with the Black Hills. I took that for granted growing up. It's beautiful out there, and I really wanted to go out there for this experience, so I'm very thankful. So yes, Spearfish is, I would say, on the higher end of rural. With that being said, they are 45 minutes away from the closest Trauma 2 center. So we did have to most of the time just stabilize our patients as much as possible and then send them usually to Billings, Montana, or Mayo Clinic or other places, just bigger hospitals, which was super cool to see because I've never been able to see the initial assessment and the chief complaints. So being involved in the initial was great. So I was more on the ER side. I wasn't super involved in the inpatient hospital side, but I do know that there are 35 beds. They were full most of the time, typical with rural facilities. We had 10 ER beds, only 6 rooms. So a lot of those beds were doubled up in rooms that weren't necessarily equipped for even one bed. Um, and then we had one bigger trauma room that was split between 2 beds. So we technically had two. We tried to keep those open as much as possible, but course, those fill up as well. When it was completely full, we had one triage room. I was able to go with my nurse quite a bit and utilize that room. Again, the initial assessment, super important to see. He was very confident with his skills as well. So I was able to, kind of be involved in that. There were 3 nurses on all the time. My nurse was the swing shift, so he was 11 a.m. to 11 p.m. So I got a little bit of the morning, how that works, and then at night. And there is a difference when there is shift change for sure. There's also one nurse manager on during office hours, and then we were lucky enough to have a charge nurse, a doctor, RT, lab, and radiology on 24/7. And that is a big game changer in rural healthcare, I believe, because having those labs right away and having those CTs read, it very crucial for those critical patients, especially if they have to wait a while for transportation. So the patients that I was able to care for were mostly local residents. So that was good. I was caring for those back home, and that's always what I've wanted to do. Of course, I had the motor vehicle accidents and the chronic diseases, homeless, and addictions, and the resources were in rapid for those, which was really hard, for the homeless and addiction because we weren't able to give them immediate resources. We had to refer them on, and most of them did not have the transportation to get to rapid for those. So overall, I had an amazing experience, and I encourage everyone to do it.
Great. Thank you, McKenna. I just had a question about outreach services then. Do you know, so for especially those patient populations that you couldn't help directly there in the hospital, was there, you said referring to Rapid City, but was there some outreach services right there in Spearfish that could help them? Did they have like a homeless shelter or food banquets or any other services like that that you could point them to?
So I know for domestic abuse victims, there is the Artemis House that's actually right across the street from the hospital. I did not know that until going there. As far as food services, it's pretty limited. We are able to give out little brochures and stuff for, I believe, prescriptions to decrease the price on those, but it is very limited with the resources. It's hard to see. Yeah.
And then did you have a case management or social workers there at the hospital to do some follow-up cares with these patients after they left?
Yes, they were very involved. The nurse manager, she was always helping us out, making sure that the patients had everything that we could supply them with. even though it was limited. But yes, they were there, very involved, and helped along the process when they were transferred on to other facilities as well.
McKenna, you talked a little bit about which comes with rural health when you're taking care of your neighbors and friends. And you talked about the rewards of that, but what are the challenges with that?
It was, and I'm keeping confidentiality. It was extremely hard to see somebody's name across the board that and but also to say like, oh, I get to take care of this person. That is amazing. This is rewarding. I'm gonna impact their life and they're not even gonna know it. And I think the behind the scenes and seeing how my community is doing health wise and how I can impact that. Definitely.
Thank you for sharing that.
Okay, we'll move on to our final case presentation for today. So Taylor Evans is our last student presenter, and Taylor is originally from Pierce, South Dakota, attending University of South Dakota in Vermillion as a nursing student, and will be graduating this December. After graduation, she does plan to work somewhere in Sioux Falls.
Yes, thank you, Katie. As you said, my name is Taylor. I'm a fourth semester nursing student here at the University of South Dakota in Vermillion, and I completed my HRSA grant back in my hometown of Pierre, South Dakota at Avera St. Mary's, and I was specifically on the labor and delivery unit, so it's going to be a little different than the last two. But Pierre, South Dakota's capital, and it's located in the middle of the state. For context, it's about 2 to 2.5 hours from Rapid, which is on the west side of the state, and about 3 to 3.5 hours away from Sioux Falls on the east side of the state. Pierre has a population of about 13,880 people. That was in 2023, which decreased slightly from just over 14,000 people in 2020. So it's on the larger end of rural. So we have a little bit more resources with that. Avera St. Mary's is a 60-bed regional facility, and that's being the biggest facility in about 112-mile radius. So the labor and delivery unit has about 12 beds, and then we had one triage room. The ICU is made up of 5 beds. Med-Surg has around 20-ish beds. The ER has 12, and then we had 3 OR operating suites. And then with labor and delivery, those beds were split up between antepartum, intrapartum, postpartum, and then we also had one triage bed just on the labor and delivery unit. So the patient population that I mostly took care of was residents of Pierre and Fort Pierre, which is just right across the river from Pierre. It's a little smaller town, and residents of surrounding communities. And then specifically on labor and delivery, I saw a lot of moms from the Eagle Butte Reservation here in South Dakota, but mainly they were healthy patients, healthy moms and healthy babies. And we were able to keep moms that delivered vaginally for 24 hours or 1 day, and then moms that delivered via C-section were kept for 48 hours, so about 2 days, unless complications occurred in which we could keep them longer and their stays would be covered by insurance. And some resources that we have at Avera St. Mary's are on-call doctors 24 hours a day, 7 days a week on labor and delivery. And then other departments also have hospitalists at the hospital 24/7 to help them out. They also offer providers in specialty fields such as physical therapy, wound care, dialysis, oncology, podiatry, dermatology, urology, orthopedics, pain management, and ear, nose, and throat. And those are all offered at the Helmsley Center, which is connected to our main hospital. And then also connected to our main hospital, we have a clinic that is equipped with urgent care, pharmacy, and primary care providers. Some challenges that I saw, as I said, I mostly cared for healthy patients, so healthy moms and healthy babies. And this is just because even being larger rural facility, we don't have resources to care for sick moms and sick babies. So if complications were to occur, we would ship them to Sioux Falls through care flight. And then we are able to give type-specific blood and like red blood cells, fresh frozen plasma. However, if platelets are needed, those are brought in from Mitchell by car, which takes about 2.5 hours. And on the topic of social and community context, during my time, I noticed that younger moms, so aged like teens to 20s, had more family and community support bringing in a newborn into the family than those older moms. And I feel though this is important for the young moms to have that support, just bringing in the newborn to the family, but also for the newborn to be able to meet those developmental milestones. And going along those same lines, I noticed that those older moms or the moms from Eagle Butte had multiple kids closer in age, but didn't really have custody of any of them, which could be harmful to their development by not having that stable care and stable home. And in an attempt to minimize negative patient outcomes on the labor and delivery unit, at least what I saw in Pierre, we had a social worker that would go around to each room before parents and newborns got discharged, just asking them about the kind of environment they were bringing a baby into and what their home looked like in case CPS needed to be contacted. Otherwise, the newborn was able to go home with parents. And then we also offered what we called newborn bundles, which consisted of cribs, car seats, blankets, diapers, wipes, clothes. And those were offered to parents who don't have the resources or means to buy those supplies in order to take care of a newborn upon discharge.
Thank you, Taylor. It sounds like they had a lot of help for this population of patients there. What were the biggest concerns that you heard from the patients about going home and the needs that they had?
Honestly, a lot of the patients I took care of were like first time moms. So just knowing like how to take care of that baby, especially if you were to deliver vaginally and we're only in the hospital for 24 hours. But we really try to do a lot of discharge teaching and then also just letting them know that if they have any concerns, they can call or come back to the hospital.
And I know some of the bigger hospitals, Sioux Falls, Rapid and stuff have like the lactation consultants that they can go in and see. They have prenatal classes they can go to, those kind of things. Was that available in your hospital too?
I don't know about like in-person prenatal classes, but for lactation, we just had a community member that would volunteer her time to come help with any questions that the moms would have.
Okay, well, thank you so much, Taylor. We will go on to our content expert then.
Great. Well, it is my honor to introduce to you Paula Mazarek. So Paula is currently the Southeast Region Nurse Team Lead for the South Dakota Department of Health, Public Health Nursing Services, and is based in Sioux Falls, South Dakota. But prior to this position, Paula was the community health nurse for the Department of Health in Bonham County in South Dakota, which is kind of in the middle south part of the state. And she did that for 34 years. She grew up near Wagner, South Dakota, and has shared her passion for public health and has served the residents of South Dakota. And so we're really privileged to have Paula with us today because she has so much public health experience over the years that she's just a wealth of knowledge and wisdom. So thank you so much, Paula, for being here. And we're anxious to hear about public health in South Dakota.
Well, it's a pleasure to be here, and it was very interesting to hear the case studies of the small hospitals that you worked in. I kind of left a gap in my nursing career as well as when I graduated in 1981. I went back to my hometown hospital in Wagner, South Dakota, where you do have nurses, students there. And Wagner is on the Yankton Sioux Reservation. I grew up north of there and now live about 20 miles from there on the weekends. And it's a really great area. And I learned so much. I think when you work in a small town hospital, like McKenna said, you get to take care of folks you know and impact their lives. You get a taste of so many things when it comes to experiences. And it's really, it was a great part and a great of my career, and it was a great way to start my career. Like I said, I became a public health nurse in 87, and I had when I left the hospital, I just saw this as an opportunity to work in public health, but I didn't really know what I was getting into, quite honestly. I remember the first 6 months of the job thinking I wanted this because it was so different than what I was used to, because I was used to working acute care and having the ebb and flow of taking care of clients and helping moms have babies and all those things. And once I figured out that public health is really kind of what you make it, it just really made a difference in my life. And I was really privileged to be able to practice for those 34 years in Bonham County. I got to take care of 3 generations, and I taught prenatal classes. I became a lactation consultant. I provided immunizations, school services. I mean, we just did a lot of cool things. In 21, they came up with this. They restructured the state in the regions, and I became a team lead. So that meant I had to leave my people. But at the same time, it was an opportunity to be able to work with nurses who did the things that I did. But my goal was to help them love it as much as I did, because this job is so much about relationships, and that's where you make the difference. And so it's been a real, a great, challenge, and it's been very good fun. I work with a wonderful team, and I'm privileged to be here. In Sioux Falls, we have a lot of different populations with a lot of many non-speak English speaking, and so that presents challenges sometimes. In the rural communities that are outside of Sioux Falls, sometimes transportation is an issue, and we have to work to meet their needs. The Department of Health had a restructure in the last couple of years where WIC kind of went on their own, because before, when I worked as a public health nurse, I was a WIC nurse too. And now WIC is kind of their own entity, and public health nursing has become an entity. Our 3 focus areas are pregnancy care, immunization services, and also school health. Now, not all public health nurses have school contracts and go into the schools and do screenings and education, but some of our nurses do. Just about every area provides immunization services, and then we also do immunization audits. But our pregnancy care probably is our biggest, excuse the pun, baby, in that providing that support to pregnant women at probably a most critical time in their life is really, really important. We also provide, you know, support, and we can get them resources. We have a safe sleep program. So during their pregnancy, we do a safe sleep screening. We find out if they have a place for that baby to sleep when they go home, and we provide them with a bassinet or a pack and play if they don't. It's one of the things that we do. Our case management services are monthly visits, or it can be telehealth. It can be virtual, on phone or in person. And we like to, do in person as much as we can, just so we can do a blood pressure check and that sort of thing. Probably the things when we teach mostly, or we really want to emphasize during pregnancy is, how to recognize preterm labor, what to do if it happens. The other thing is count the kick, and towards the end, after 28 weeks of gestation, making sure moms know what they need to do if they notice their baby's movements are down or decreased. And then, like the breastfeeding support, a lot of our nurses are CLC certified as well, or know where to get those things. So um, I'm excited for you guys to graduate and get into the world. Thank you for becoming nurses. We need you. And I may be a fossil, but I am not one of them old nurses that eat the young. I support you, and look forward to working with you someday.
Thank you, Paula, for that information. Would you mind just sharing with us about, I know you talked about Sioux Falls, but do you know how many public health offices there are throughout the state?
Well,
Um,
we just changed regions, and I should have probably had that number on my hand. So there's 3 regions, and the southeast is the region that I belong to. And it's as far north as Sioux Falls, down to Union County, over to Chamberlain, Brule, and then down to Burke. And so we have, I think, we have more offices than we do nurses. So we have nurses that do a do some traveling. And in the past, the counties contracted with the state to put a nurse into their county. Sometimes, that has some of that has gone by the wayside, but we still continue to provide services in those counties. They provide a spot for us, and but nurses, aren't in that community per se anymore. But for the most part, we still have a face in the community. And if you go to the Department of the DOH website, which is sddoh.gov, that will, you can bring up on the website how many offices there are. The West Central is together, while they look like half of the state. Population wise, our region ends up being bigger than theirs just because of falls, honestly. But for the most part, and then the Northeast is from Sioux Falls, up to the North Dakota border. And then I think over to Aberdeen and Huron are included with those. And every area has kind of some specialty populations. Like on the east side of the state, we have, Hutterite colonies. And so many of my nurses that I work with have of 2 or 3 colonies that they work with. When I was in Bonham County, we had initially one county and then colony, and then one came in. And the Bonham colony is the oldest one in the nation. And so they are interesting and fun folk to work with. The first time I went out for a postpartum visit, I think they asked me more questions to assess what was going on in my world than I got to say. But they are a real fun population to work with. And then I would go out and provide immunizations on site for all those kiddos. And so and some of those mamas would just be so proud because they'd show me their record that I'd vaccinated them when they were a child too, and they'd be like, "Yeah, you're just reminding me of how long I've been here." But it's and then in some of in the Huron area, they have a lot of Karen, sometimes they say, and there's Spanish pockets of Spanish speaking folks, and that's their only language, kind of all over the place. So it's uh it's very interesting, that's for sure. I think that there's probably about 60 public health nurses. What happened was when when WIC and public health divided, they asked us nurses, what do you want to work with? Do you want to do the WIC program or do you want to do public health? And so it actually, whatever people chose, they got for the most part. But as things have kind of gone on, we found that some of the services we needed to tweak a little bit. And so that's why we have the nurses traveling to cover and do that sort of thing. But for the most part, it's fun to expand your area. I always learned new things when I traveled to other areas. So it's a good thing. It really is.
So do different offices have different services then?
Yeah, we have some nurses that provide school health. So when they have the school health contract, they might go into 2 or 3 different schools and provide education, but we also do school screenings on certain grades. We do vision and oral, an oral screening and a total health assessment and scoliosis screenings. And so we do some of those things in the schools that have contracts with us because some schools have their own nurses. And so not all nurses do that services. Most nurses will provide some immunization services, and we all end up having to audit immunization records. Every kindergarten coming into the school system, and every 6th grader, their immunization record is audited to make sure that they have what is required by law. And unfortunately, what we've been seeing in the last years is that there's been an increase in folks that are claiming a religious exemption. And a lot of them, they had their shots up until a certain point, and then they just decided that they didn't want any more. So they signed the certificate of immunization saying, I'm religiously opposed. which is unfortunately. And just about everybody has some pregnancy care services, but some areas have much higher caseloads than others. And Sioux Falls, we have the lion's share right now. I think right now in Sioux Falls, we probably have about 150 women that we're following on the pregnancy services. And maybe in Mitchell, they have about 25 or 30, and Yankton has about 20. It just depends on, the ebb and flow of the caseload. And our pregnancy program is eventually going to go so that we serve these women not just until they're 12 weeks postpartum, but we're going to serve them until that baby turns 1 year of age. We have some programs here in a program here in the state called Bright Start, and they actually follow those kiddos until they turn 2 or 3, I think it's. So this one's not quite as intensive, but it's at the same time, we're there when those folks need us the most.
Well, I think I could just keep asking you questions, Paula, for this is so interesting, the work that you do and the work that your career, it's just wonderful. But I'm going to open it up to all of our audience, and I would like to hear any questions that anybody has for Paula concerning public health nursing, concerning community health, and this serving people in rural populations.
When I was in school, I'm going to just say something more too. When I was in school, I was doing my public health, rotation, and I was in Lake County, and the nurse said, "Have you, I know they need a nurse in Charles Mix. Have you considered this?" And I said, "No, no, I haven't," because I already had a job kind of lined up at the community hospital, and I have a sister that is a nurse as well, and my family will joke that my sister Penny is the real nurse, because she's in a hospital, and I don't know, I'm pretend nurse maybe, I don't know, even though I've been
No,
a
you're
nurse for
the doing primary interventions. You're the prevention nurse, and you're
yeah, we're trying to
preventing.
keep them out of the hospital. So,
Yes.
yeah, so, we used to joke that, I wasn't a real nurse. So but at the same time, our skill set is different, but I tell you what, our impact is great. And so, if you know, don't dismiss public health as a boring, numbers job, because it's not. And I always say that, like when I worked as a hospital, the people that came to see me were patients. They oftentimes weren't there on because they really wanted to be there, they had to be there. And so when I talk about the folks that come to see me now, I call them clients, because they can choose whether or not they come to my and have my services. And they are giving me a privilege to be part of their life. And so it's really been, like I said, a really amazing blessing. And the services that we provide, they're kind of, like I said, we're under the radar, but at the same time, they're still very important.
Are there any questions for Paula? Well, thank you, Paula, so much for being with us today. And just as an overview of this session, we examined the various health challenges faced in rural communities of South Dakota. We looked at some specific communities. We identified and explained how social support systems such as family, community networks, and social services affect patient health and recovery, particularly in the rural population. And then we also explored ways to advocate for patients by addressing the social and community-based needs through interventions, referrals, and collaborations with other professions. So thank you for being here, and thank you, Paula, for being our subject matter expert today. We so appreciate it.
Wonderful. Well, thank you for taking the time to join us once again. We do ask that in conclusion of today's presentation, you take a brief moment to complete our post event survey. I'm going to go ahead and stop share so I can put this right in our chat box, which will make it a little bit easier for you to grab it. These surveys go a long way in helping us prepare future topics and subject matters. So we do appreciate you taking the time. Thank you to our presenters for joining us as well. Oh, I've got you in the wrong. There we go. You should be able to access that in the chat right now. So thank you to our presenters and everyone for being here. We hope you have a wonderful rest of your day. If you are in the US, we wish you a happy Thanksgiving, and we hope to see you at a future webinar soon. Thank you, everyone.